Nearly 200 years ago in Paris, a small group of young Catholic women brought compassionate care into the homes of the sick and the dying. They became known as the Sisters of Bon Secours. Bon Secours means good help in French, and bringing good help is the mission of the Sisters of Bon Secours. Good help came to the United States in 1881 when 3 of the sisters sailed to Baltimore, Maryland, and they continued their tradition of healthcare in the home of those in need. Today, that tradition continues through our sponsor, Bon Secours Ministries.
Magnet status is an honor to be a part of, and it's nationally recognized, and it shows that we are in the top 1% of most of the national averages.
I'm so proud that Memorial Regional was given recognition with the magnet status, and I truly believe that all of the nurses and physicians work so hard to increase our patient satisfaction scores.
It means that an ordinary nurse like myself with just one small voice can make a huge difference in the world and accomplish great things.
The nursing culture at Memorial Regional Medical Center is open. It is honest, it is trustworthy, it is respectful, it is dignified. The nurses here treat patients with the extreme compassion. We want every patient to be treated the same way every day and allow nurses to bring their best self to work.
The exceptional work that happens comes from them. It comes from the team. It comes from their ideas and their thoughts and their own experiences. And some of our best ideas and practices come from them. And so I would say they give me more direction and guidance than I give them.
There is a candle in every soul, some brightly burning and some dark and cold. And hold out your candle for all to see it. Take your candle and go light.
St. Francis has achieved magnet status, the highest recognition of nursing excellence in the nation.
CHA is so grateful to our members for their very generous contributions, which I am sure will pay great dividends for the people of Haiti. The needs in Haiti are astounding, and this new hospital is going to make it possible for the people of Port-au-Prince and the surrounding community to have the modern and mission-driven health care they need and deserve. And I want to say a very special thank you to Bon Secours Health System, not only for your very generous contribution, but also for the interest you've continued to show in this project.
When I was in the military, I went in for air traffic control. I became a turnaround instructor, which made me the first black female instructor for the air traffic control school. My life has changed dramatically since finding Mercy Housing. I had no idea that there was housing available like this. Before I came to Mercy Housing, it was really, really difficult trying to find accessible housing. When I saw this place, I was like, this is just unbelievable. It is affordable. It's set up so perfectly for someone who is like me in a wheelchair. The countertops, the stove, everything is at a level where it's safe. I pretty much love everything about my home. I feel safe, and the management, they do more than you expect for us as residents. They work from their hearts, and I know that.
Robot simply means, in its bare minimum, interfacing between the surgeon and the patient a device. And that device might be a large machine, It might be a small object like this. So the robot never does the surgery on its own, and my robot never makes rounds on its own. I've never come in the morning and heard that, oh, I heard you made rounds, when I actually didn't. The robot came to life. These are simply machines that we place between us and the patient to aid us. The robot that we're talking about today enables me to see a patient, to visualize what they look like without actually being there. It's called a double robotic. I guess you could call it an iPad on a stick with wheels. And it enables us to wheel up to our patients and get up close and look at them, and they can see me, and I can certainly get a look at them and the numbers up on the monitors and all, and brings me a little closer when I'm farther away. I tend to look in on my patients the first post-operative night. Our patients, after a long day of surgery, will very frequently come off the breathing machine and be fully awake early in the evening. The idea or concept of what we call telemedicine has been around for a couple decades, but not really used extensively until the past 5 or 10 years. With my iPhone, I can pull up the robot activated from anywhere. The big advantage I have with that is the ability to connect to them whenever I want. I used it initially to try it out and see how it worked. And now I use it frequently, almost every night, for a patient who's a fresh post-operative patient who has just come out of the operating room. It gives me a little bit of peace of mind. We have spooked a few people, unfortunately, as we come down the hallway. It's a very silent device, and if someone is not aware of it or not looking up, suddenly an iPad appears in front of their face. I've had quite a few oohs. It takes a little getting used to for the staff, but the patients don't seem to be surprised that much. They'll take a look and they recognize my face, and again, usually burst into a big smile.
My name is Sister Dorothy Brogan, and I'm from Greenville, South Carolina. I was 19 years old when I entered the Sisters of Bon Secours. I felt a call or a draw to help people who were sick. I discovered when I worked in the hospital that I had a real aptitude or a gift to work with people who had been diagnosed with cancer. My role as a chaplain is to listen, to be present, helping people to listen to their own story, to tell their own story, to find their own meaning in what's happening to them. We hope that the new St. Francis Cancer Center will be a place of hope, a place of healing, and a place where people will receive expertise in medicine. I've been ministering to the sick for 60 years. That excites me, for as long as God lets me do it.
Thank you all. What a beautiful day for this wonderful, exciting event. So I want to thank Sister Anne-Marie for that kind introduction, and it really is an honor to be here today to kick off and celebrate the launch of the Mobile Learning Kitchen. Bon Secours is doing such wonderful work in partnering with organizations and residents in our community who share the goals of increasing food access, food resources, and building healthy communities through education and wellness efforts. I truly commend them for these efforts because if we hope to create a healthy Virginia, and I know we all do, and to build a 21st century economy, we must first address the nutritional divide that separates many families from the healthy foods they need. We have to make healthy foods convenient, affordable, and available to all Virginians, and we should work hard to help Virginia's farmers supply more of those healthy foods. While we must work hard to ensure that our hardworking farming families can sell more of their products locally, it has to be for a fair price. This is something I'm passionate about as a mom and advocate. Thank you for your support in growing our next generation.
To you, don't waste your time.